for Health in the 8th province, Dr. Noma Mbombo, on the attendees. I'm not sure if the other MECs have joined from the provinces.
I haven't checked. Who is Lunga? Foster, who is Lunga?
Lunga is maybe it's one of the media people. Let me see.
No, but this Lunga is on the panelists.
Let's see, Lunga. I think it should be IT person.
IT person.
Yeah, I don't see. I think Mr. Piri can be able to confirm if it's our IT person.
Okay, no, that's fine.
Let me see if Minister is joined.
I don't join anything.
Let me see.
Yeah, I will first.
Yes, finally the minister has managed to join. We can now go live. Apology to our members of the media for that few minutes delays, and also the delay from 12:30 to 1 o'clock. Without wasting any time, I'm going to shoot straight into the introduction so that we can start officially with the media briefing. Once more, my name is Phaahla. I'm responsible for media relations in the National Department of Health, and also serving as the spokesperson for the department. Let me start by saying compliments of the new year. I haven't seen most of the people here, including my colleagues, but we've been speaking throughout the festive period. So without wasting any time, I'm going to acknowledge the presence of the Minister of Health, Dr. Phaahla, the Deputy Minister of Health, Dr. Vincent Lomo, the DG, Dr. Sandile Utelezi. We're also joined by our specialist from the NICT, Dr. Michelle Krum, who's going to also assist, make some contributions. Minister, before I hand over to you, I've also noted that we are joined by the MEC for Health in the Western Cape, Dr. Noma Mbombo. I'm not sure if there are other MECs who have joined because the list is very long. So on that note, I'm going to hand over to you, Minister, to take us through. Over to you, Minister, Dr. Phaahla. You are muted, Minister. Yes.
Sorry about that. Good afternoon. Greetings to you, Mr. Foster Mohale, the director of this media briefing, Deputy Minister, Dr. Swanseni Lomo, And greetings also to our colleague, MEC Mbombo from the Western Cape, and any other MECs who might be also joining, DG, Dr. Butelezi, and all other officials from the department, colleague, our specialist from the NICD, Dr. Michelle Groom, all other guests, and good afternoon also to our media friends who thank you very much for heeding our call to participate in this media briefing. And Happy New Year. I hope it's still not too late to say Happy New Year, and compliments of the new season is still the 10th of January. Now, we have convened this just to give an update in terms of where we are with the COVID-19 pandemic. The National Department of Health and its entities, amongst them the National Institute for Communicable Disease, and also our Ministerial Advisory Committees actually have been monitoring developments with regard to the COVID-19 globally. All this time since we lifted all the restrictions in June 2022. Also, the genomic surveillance team has also been continue to work under the auspices of the Network for Genomic Surveillance of South Africa to do their work in terms of looking at any changes in the genomic makeup of the virus. Globally, in December 2022, there was an increase of up to 25%. This is what we get from the World Health Organization. An increase of up to 25% with 14.5 million new infections in December. And also a 12% rise in the fatalities from the COVID, just under 50,000 at 46.6 thousand in deaths compared to the figures of November 2022. The countries which have been leading in this regard have been Japan, South Korea, United States of America, China, and Brazil. These countries represented 70% of the new infections which were reported in December 2022. Just in the last week of, especially in the last week of December 2022, but the earlier figures which I mentioned was the whole month. Now, in the last week of December 22, there were more than 3 million. I mentioned that the total month was about 14.5, but just in the last week of December, more than 3 million new infections and at least 10,000 new deaths which were reported. Although in this last week of December, there was, compared to the earlier weeks of December, there was a reduction, a 22% reduction in terms of new cases, and an 18% reduction in terms of deaths as compared to week 51 of the year. So we're talking about week 52 of 2022, the last week of December. Now, in this last week of December, new cases reduced in all the countries which we have mentioned earlier, except in the People's Republic of China, that is in the last week of December. Now, in this week 52, China's cases increased by 45% and deaths increased by 48%. As many of you would be aware, there have been several reports of overburdened hospitals in the People's Republic of China, and also crematoriums and other burial places were also said to be quite overburdened during December and also in the early period of this year in January 2023. This is the situation which has caused a lot of panic in various parts of the world, including among some of us in South Africa. As a result of these developments, a number of countries imposed special requirements for travelers coming from the People's Republic of China. And amongst these, there are 12 countries specifically which are known to be requiring a negative PCR test of less than 48 hours for all travelers from the People's Republic of China. Amongst those countries, the 12 is the US, UK, Canada, France, Taiwan, the Philippines, Spain, Italy, India, Israel, and also Japan. Malaysia and South Korea require both a negative PCR test plus also a test on arrival in their countries, while Morocco is thus far the only country which we know of which has imposed an outright travel ban on travelers coming from China. The rest of the world has not changed their position, meaning no new measures, while countries like Germany, New Zealand, and ourselves have thus far indicated that we had not imposed any new requirements for travelers to and from China. Here in our country, on the 7th of January, the Genomic Surveillance Unit at Stellenbosch University, which is a member of the Network for Genomic Surveillance, reported the detection of XBB.1.5 subvariant from a specimen which was obtained from a patient on the 27th of December 2022. So even though the announcement was made on the 7th of January, this specimen had been obtained from a patient on the 27th of December. So because the genomic surveillance is not done at the basic laboratory, whether it be NHLS or private laboratories, so that's why the time lag between the collection and the reportage of this XBB.1.5 subvariant. The specimen was submitted to the genomic surveillance as a random sample. So there are no details of the patient. The emphasis here also is that the patient may not even be from the Western Cape, because this was a random sample which was submitted for genomic sequencing to the laboratory at the Stellenbosch University. So what do we know at this stage? What we know at this stage is that the SARS-CoV-2, commonly called COVID, the variant of concern which remains dominant in the world at between 97 and 98% remains the Omicron variant of concern. Remember that it's only when there is a significant, in fact, major changes in the makeup of the virus that it then becomes a new variant completely. As we know that we started with the Alpha, the Beta, the Delta, and then the Omicron variant. That's Omicron has had more than this. So Omicron remains the dominant variant of concern throughout the world at between 97 and 98%. This Omicron variant of concern, which is dominant, has had more than 100 subvariants or sublineages since it started to dominate the COVID-19 environment late in 2021. The Omicron subvariant is also dominant in the People's Republic of China in the form currently of a subvariant called BA.5.2 and also a subvariant termed BF.7. Both of these constitute 97% of the circulating variant of concern in the People's Republic of China, which are the subvariants of Omicron. The XBB.1.5, which was detected in Stellenbosch, has been detected more in the US, where its prevalence is rated as about 6.8% of the circulating subvariants. It is also, again, to emphasize that it is also a subvariant or a sublineage of the Omicron variant of concern. So while the various subvariants or sublineages have shown different levels of transmissibility, there has thus far been no marked change in severity of illness. I think I want to emphasize, therefore, that while you would hear that this and that subvariant, it's more transmissible, thus far there's been no indication of change, major change in terms of severity of the infection and in terms of severity of illness and even in terms of fatalities. So the major reason for the reported overwhelming of the health facilities in the People's Republic of China and high deaths is the recent opening of restrictions, allowing people to travel more freely, after a prolonged lockdown with a very huge population of 1.4 billion people. So the opening up in a situation where in many communities there's been prolonged lockdowns, which means that there's very limited natural immunity. And also there's also apparently in some areas of the People's Republic of China, limited vaccination, especially in the rural areas and in the small towns. So that explains the situation. So at this stage, I want to emphasize again that even in the People's Republic of China, there is no indication that these variants, subvariants are more severe in terms of illness, but it's just the sheer numbers in a huge population where people are now traveling freely, both in the country and also able to travel out of the People's Republic of China. We believe that the fact that the dominant variant of concern in China and in the world remains the Omicron, and that the immunity of South Africans from vaccination and natural immunity is still very strong. This puts us in a better position and in less risk. And that is why we have not seen up to this stage any major changes in our epidemiology in terms of the rates of infection, also in terms of admissions to hospital, and even the rates of fatality from the COVID pandemic. We have consulted our ministerial advisory committees and also WHO, the World Health Organization in Geneva, and also the regional office in Brazzaville. And in both cases, the advice that we have received is that there is no need to impose any travel restrictions on any country, including the People's Republic of China, and that we also do not need to reimpose any restrictions internally in our own country. We have, however, been advised to take the following measures, amongst others: to increase the rate of testing. That is, that we must encourage people who experience the known symptoms of COVID, just to remind us, flu-like symptoms, fever, headache, cough, amongst others, but also symptoms such as body aches, tiredness, loss of appetite, and also at times loss of taste, and even sometimes diarrhea. That when we do experience any of this, and sore throat, just to mention, when we do experience some of these symptoms, we need to approach health facilities. And we also encourage our practitioners in health facilities, including in the private health facilities, to order either an antigen test or a PCR test. And if the antigen test is positive, then a PCR confirmatory test needs to be done. For every positive PCR test, a specimen must be sent to the NHLS and NICD so that it can be forwarded to our genomic sequencing network. So we would want, because at the present moment, part of our challenge is that the number of tests and also the pool of sequencing specimen available for sequencing is very small. So we need to increase the pool of testing and also for the sequencing purposes as well. We need to increase surveillance. So the NICD will also increase in this regard wastewater testing for COVID-19, including also from aircrafts coming from high-burden countries. Currently, this would be from the People's Republic of China, but possibly the US with the dominance of the XBB.1.5, the aircrafts coming from the US and any other country which also emerges as a rising, infections. The aircrafts arriving from those countries will also, the wastewater from those aeroplanes would also be obtained. Samples of the wastewater will be obtained for testing to detect any COVID-19 virus, and if it's detected, to subject that also to a genomic sequencing. In this regard, I've already signed a letter a few days ago to all provinces. I hope MEC Mbombo, I hope has received that, and your office, and we've sent a letter to all provinces and laboratories to increase the levels of COVID-19 testing. We also have been advised to reinvigorate the vaccination campaign, for COVID-19 with that we must step up our communication and also our messaging to encourage more South Africans, those who have not yet vaccinated, to come forward, and also those who have not yet received boosters to come forward. Our vaccination Ministerial Advisory Committee will soon make adjustments to qualification for boosters per age, and also the timelines between the boosters. So we're looking at the VMAC is looking at including in the boosters not only the people over 50, but also all adults from 18 years on upwards, and this we expect this in the next few days to be finalized. I wish to indicate that the measures which we have mentioned as the steps which we need to take, increasing surveillance, testing, and also increasing the levels of vaccination and messages and communication for vaccination. These measures were presented to the National Coronavirus Council, chaired by the President early this morning, and the NCCC, chaired by the President, have approved all these measures, and that they agree that there is no need to either bring in any restrictions for travelers or even any new restrictions for the country. So as I conclude, I want to again emphasize that vaccination remains the bedrock to protect us against any variant or any subvariant of the COVID-19, and not travel restrictions or any new restrictions at this stage. So that is the message which we want to give to the people of our country. Thank you very much, Coordinator, Mr. Foster Morale. Thank you.
Thank you very much, Honorable Minister, for that update that the public has been waiting for. Without wasting any time, I'm going to allow one of our panelists, Dr. Michelle Kru from the NICD, is one of the specialists who we've been working with throughout the pandemic, to make the inputs as far as the NICD is concerned. Over to you, Doc.
Great. Good afternoon to everyone. Yeah, I just wanted to provide a little bit more information on the new variant, and I think really just to say that this is not unexpected. We have seen with COVID throughout the 3 years of the pandemic how we would expect the virus to have new lineages, new variants, and with Omicron there are many subvariants of Omicron, and so the detection of this XBB.1.5 is not unexpected. It has been detected in many other countries. It's been in the US since October, and while the proportion is increasing there, with some of the data sources saying it may be up to 40%, but I think, while it may become the dominant variant there, it does not mean it will become the dominant variant elsewhere. We've seen with some of the other subvariants that a certain subvariant dominated in the US, whereas it didn't become dominant here. And there's quite low levels of this in Europe at the moment and in other countries. And I think we need to realize we have each country is different. We have very high levels of population immunity. There are many people in our country who've been exposed to the different variants or subvariants of Omicron since it was first detected at the end of 2021. And so I think there does not, although there is some evidence that it may be slightly more transmissible than the ones that are circulating at the moment, this evidence is relatively weak. We're still waiting for more data on that. But even if there's a small increase in transmissibility, as with other variants, we have seen that vaccination and prior infection and high levels of population immunity provide protection against severe disease. And so there's no evidence that this variant has any difference in severity or clinical presentation. It has not been causing more hospitalizations. So I think really just to just to be cognizant that this is just another subvariant amongst Omicron, and that we know what works for COVID and what has worked for us over the last years, as the Minister has outlined. And just to also note that through our wastewater surveillance, which the NICD is conducting, shows very low levels of SARS-CoV-2 in the wastewater at the moment. And so we will continue to monitor that as well. Thanks, Minister. That's just all I wanted to add.
Thank you, Dr. Michelle. I'm not sure if colleagues they want to make the inputs. We've got Dr. Bamford, we've got DG, we've got the Deputy Minister before we shoot straight to media questions. DG, any input? Dr. Bamford, Dr. the Deputy Minister, any input? You are muted, DG.
No, nothing from us. From my side, the minister has covered us.
On that note, I'm going straight to.
I agree with the DG.
Want to say something?
I agree with the DG. We are covered by the minister. Thank you.
Okay, wonderful. I'm going to take the first batch of media questions and send back to the minister and the panelists to assist with the responses. The first, we've got about 11 questions. We'll take the second batch later. The first question is, please, will you advise when will the children aged 12 to 17 receive the third booster dose of Pfizer? It has been a year since this age group received their second Pfizer vaccine, so it will be appropriate if they can be offered the third booster dose. Second question, why are the vaccines still being pushed despite overwhelming evidence that it does not prevent transmission or becoming sick? Third question, how many cases of the new variant have been detected in the country? And will the department consider putting the fourth or putting more travel requirement at this stage? How many cases? I think Minister did touch on this issue, but we can feel free to emphasize once more. Question number 4, why are we taking advice from WHO and other discredited organizations? I don't know who are these discredited organizations. Are we no longer autonomous? So I believe the panelists will be able to respond, but we've been working closely with the WHO. Question number 5, when will the department start conducting informed consent workshops regarding these experimental treatments? Next question, is there a change in the protocols for those who test positive? We have applied that if you are asymptomatic, you may come to work. If symptomatic, you can work remotely. So are there any changes with regards to this protocol? Next question, what is the Department of Health's view on the recent peer-reviewed paper by Dr. Asim Malhotra on the dangers of COVID-19 experimental vaccine? I'm not aware of this peer review paper, but I believe the specialists, the experts like Dr. Michelle, Dr. Bamford will be able to assist. Last 3 questions, are booster shots open for those who are vaccinated more than 6 months ago? We did announce at some point late last year that we'll be opening for additional booster shots. I believe Dr. Bamford will be able to advise on that. Are the new vaccine variants, including bivalent boosters, under consideration? The last 2 questions, is heterologous boosting still an option more than one vaccine type, since this may confer stronger immunity? The last question of the first batch, is government lobbying for lower costs of vaccine, not only for us, but for other developing countries? So this is the first batch of questions. I've read out 11 questions. If the panelists feel that I need to repeat some of the questions, I'll do that. So I'm going to hand over back to the minister to assign the panelists to assist with these questions. Over to you, Minister.
First up, could we, maybe I might be the only one, the question about the peer review paper. Can you just repeat that one? I think it was either 7 or somewhere around there. There's a question about the peer-reviewed paper of a certain scientist. It might be, you are muted.
Okay, yes. Yeah, I sent you some of these questions, Minister, directly through your WhatsApp. Can check them. Yeah, just to repeat question number 7. What is the Department of Health's view on the recent peer-reviewed paper by Dr. Asim Malhotra on the dangers of COVID-19 experimental vaccines? So apparently there was a peer-review paper conducted on COVID-19 experimental vaccines. So the journalist wants to get the viewpoint of view from the Department of Health. So if there's any other question that I need to repeat, Minister, you let me know, and other members of the panel, so that you understand the question before you respond. Back to you, Minister.
Okay, let me just try and see what who can assist us here on the boosters for children. I think Dr. Leslie Bamford could help prepare to answer that one. I'll deal with why I think the questioner was saying, why are we pushing vaccines when they are shown not to prevent disease and illness? I'll deal with that. Cases of the variant, I can just comment, and maybe Dr. Michelle Groom could also say something. Take advice from WHO, I can deal with that. When are we going to get improved consent? I think, again, DG and Leslie Bamford could possibly just deal with this, because anyway, it's as if we don't have informed consent currently, but again, on protocols changes, DG can deal with that, whether we have changed any protocols in terms of asymptomatic, symptomatic, and so on. The peer reviewed, as Foster has indicated, I'm also not familiar with this. So we could, I don't know if Dr. Michelle Groom might have some knowledge, or Leslie, on this peer-reviewed paper. And also, I think there was a question on booster shots. I didn't get the full question. And also about bivalent vaccines. Maybe again, Dr. Leslie Bamford could help us. Also heterologous vaccines. And then the lobbying for reduced prices, I could comment on that. Let me just deal with the ones which I said I can quickly deal with, and then the colleagues can also pick up the ones. The question of why we still, as the questioner inverted commas said, we're pushing. We are advocating for vaccination. And the reason we're doing so is because the vaccination has proven beyond reasonable doubt, beyond any doubt, in fact, since there has been, vaccination, any changes in the nature of the virus in terms of a variant, starting with the Omicron and also its sublineages, have resulted, even when there's been high transmissibility, has been resulting in milder illness and sometimes even asymptomatic infections. So to the contrary to the question, indeed, vaccines have proven to be effective. Not in terms of preventing one to be infected, but many of us who have been vaccinated, even as and when we did get infected, it remained very mild. And statistics are there. And in the past, when we did weekly briefings, we're able to also on a weekly basis show the difference. Even at the height of the Omicron fourth wave, we could show that. And cases of the variant, the XBB.1.5, as we have indicated, that's far only one specimen was found to be, the testing positive for this subvariant. Thus far, in terms of further sequencing, we have not received any further reports. It doesn't mean that they are not there, but they have not been reported. And as I've indicated, this was an a random sample with random. Once it is picked at the random basis, it means you don't have the name. So following the confirmation of this subvariant, it couldn't be traced to an individual because it was a sampling, a sequencing sampling, which was done on a random basis. So there was no possibility of a contact tracing, and therefore at this stage, it's only when known samples are tested and there's further contact tracing that it could be possible to check whether there can be more of this variant at this stage. There was a question about why take advice from the WHO, which according to the questioner is discredited. As far as we are concerned, the World Health Organization is the body which is recognized by, if not all countries, members of the United Nations. There might be one or two countries which may take that position. We know that even the US, which at some stage took a different position, have changed their direction. So basically, we remain confident that the WHO is the body with the necessary know-how, the necessary capacity to advise us and other countries, especially in pandemics and other major health challenges facing the world. From my side, I think the last one I'll deal with, the one on lobbying for reduced prices. Definitely, we have been doing that from the height of the pandemic, and we're still doing that whenever we get opportunity at various fora, whether it be at UN, whether at WHO, at bilateral meetings, at various fora, including the G20. So that is definitely what the question of making sure that the technology to produce vaccines is made available to all countries so that we can all build our capacity to produce vaccines. If we have the necessary know-how, we can be able to do so. But also, this will also, allow prices also to be reduced. Let me then give over to other colleagues. I think Dr. Bamford, there are quite a few on vaccines, and other colleagues like DG could also come in. Thanks, Foster.
Thank you, Minister.
Foster, shall I come in and answer some of the questions related to the vaccination program?
Yes,
please go ahead. Yes, yeah.
I think the questions that were assigned to me. So first of all, a question about booster doses. So as people are aware, adults 50 years and older are currently eligible to receive a total of 4 doses, and adults 18 to 49 years of age are eligible to receive 3 doses. So it is our intention to offer an additional dose. So that will be a 5th dose for people 50 years and older, and a 4th dose for people 18 to 49 years of age. Our expectation is that those additional booster doses will be available during January, probably towards the end of the month. But we are working very hard to be able to provide those additional doses as soon as possible. Those additional doses will also be available for people who are immunocompromised. So we are combining, I saw there was a question around that, people who are immunocompromised will also be eligible to receive those doses. So those doses will be made available to all adults. We will continue. Already our booster doses are heterologous booster doses. So people can mix and match between the 2 different vaccines that are available in South Africa. And we will continue to offer the heterologous boosting. With regards to the bivalent vaccines, we do not currently have any plans to procure those vaccines. However, the Our scientific advisory committees have been asked to review and make recommendations with regards to whether we need to give any consideration to switching from our current vaccines to the bivalent vaccines. That would require a number of steps, as those vaccines are not yet registered in South Africa. So we certainly have no immediate plans to introduce them. But as I've indicated, our scientists, our scientific advisors are looking at the evidence and will make recommendations in that regard. I think the final question regarding booster doses for children 12 to 17 years of age. As you know, that age group is eligible to receive 2 doses of the Pfizer vaccine. Our VMAC, our Vaccine Ministerial Advisory Committee, has indicated that they currently do not recommend that we provide booster doses to that age group, based on an understanding that the protection provided by the 2 doses should be adequate in this age group, which is at low risk of severe COVID infection. I think those were all the questions that were assigned to me. So let me hand back to the program director. Thank you.
Over to DG.
No, thank you very much. Thank you very much, Minister. And thanks to the colleagues and all the questions. I think the first one on the protocols have not changed, both for symptomatic and asymptomatic. So we have not changed those protocols. So the status quo remains in terms of that. And then when it comes to the issue of informed consent, basically for any experimental or research work, informed consent is part of the requirements for you to get ethical clearance for that kind of work. So, and as a department, we work quite close with SAPRA also on that one. So I think it was just a general question. It was not related to the vaccine because this is not experimental work. That's why the vaccines had to go through proper regulatory approval for implementation. So if that referred to that, no, then the question is misplaced. But for any other experimental work that gets done within the facilities through the research organizations, the informed consent is a standard, and it wouldn't go through SAPRA, it wouldn't go through the ethics committees that are responsible for that. Thank you very much. I will then invite Dr. Michelle Kroom.
Thanks very much. So I'll just touch on the issue of the peer-reviewed paper. So I think this is a paper from a single person, and I think as scientists we really rely on a body of knowledge, and so I think there's overwhelming evidence and many papers supporting the use and safety of COVID-19 vaccines, and the vaccines have been extensively tested and administered to many people, and although there are some adverse events, they are minimal compared to the effects of COVID-19 disease itself. And so we have seen very severe disease, long-term effects of COVID-19 infection and disease itself. And compared to some of the minimal side effects from the vaccine, there's overwhelming evidence that the vaccines will protect us against severe disease. And so I think it's a body of knowledge, and there are many papers available. And so to single out a single peer-reviewed paper, I think it's important to look at the type of journal and how the peer review has taken place when looking at these papers. So I would just encourage participants to just have a look widely in terms of the literature that's available on the safety. I think there were a few other questions just in terms of the variants, and I think, as I said, I think we've detected this one case. There most likely are other cases of this variant. There's very little known clinically about this particular patient in South Africa who had the XBB.1.5, but I think it really doesn't give us much information. This variant has been detected in many other countries. It wasn't detected here first. It was first detected in the US. I think there's many countries who have detected this variant. And as we've seen from the past, these variants, there's no way to control them. They will move with the movement of people. And we saw, the restrictions that were in place on South Africa towards the end of the year before last, when we detected initially the Omicron variant, and yet that spread very quickly throughout the world. And so the detection of this XBB variant in South Africa really is at this stage, we're monitoring all the variants. We have many other variants. We have the variants already which are circulating in China, and so it doesn't affect our response, and we know that all the existing variants have had very good, the natural immunity, as well as immunity from vaccination, which we call hybrid immunity. When you have a combination, is protective against severe disease. So I think I'll stop there and hand back to you, Minister.
Thank you very much. First up, before you go to the next batch, I think the only thing I can add to DG about consent is that as is indicated, the questioner suggested that the vaccination program going on is still experimental. And again, agreeing with the DG that this has been tested and before they could be rolled out. So we disagree on the experimental nature. But just to say also that for any medication, especially injectables, including vaccines, if the questioner had been to a vaccination site, they would be aware that before you take up the vaccine, it's explained to you. And then after that, you also have to sign to acknowledge that it's been explained and that you accept. And so there is a consent before you can be vaccinated. And if it's a minor, it's the parent who provides the consent. So even though all in all, in terms of vaccination, even above 12 years and above, the child of 12 years and above can also sign their own consent, but we have always encouraged that even for the 12 to 17-year-olds, that preferably the parents should be also present, or have, even if not present, but should have provided the consent. That's the ideal way we would want, although legally, children above 12 years, in terms of medicine such as the vaccination, they are allowed to make their own consent. Thank you very much, Foster. I'm not sure if there's any other remaining, and if you want to invite any member, maybe in the next batch, more of our colleagues could come in. Over to you.
Thank you, Honorable Minister and members of the panel who assisted with the first batch of questions. The second batch is quite longer than the second one. We have the third, which I'm going to combine the second and the third in the best interest of time. The first question on the second batch is as follows. Some of the questions, if I think there's a repetition, other journalists, they repeated the questions from the previous batch. We can just flag them. The first one reads as follows: may we please have an update on the expiry dates of our current stock of Pfizer vaccine? An update on the expiry date of current stock of Pfizer vaccine. The second one, will we get a memo for COVID-19 guidelines update for change in testing guidelines? Third question, when will the age group below 50 years be able to receive another booster shot? Some people within this age group received their previous booster almost 12 months, so that immunity is waning. So I believe Dr. Bamford did touch on this. I hear someone is not muted. Let's first check who's the person so that let's see. Arnold, can you check who is not muted so that we can continue without any disruptions? Ms. Arnold? Yeah, as you try to mute the person who is muted, let me continue. The next question. I think, let's see.
It's actually Arnold that is not muted.
Arnold, can you mute? I've muted him. Okay? Let me continue. Apology for that technical disruption. The second one, or another question: since the new variant was found in the Western Cape, can the MEC of the Western Cape, Dr. Norma French Mombo, comment on the COVID-19 situation in the province and how many cases and hospitalizations have been reported? If the MEC is still here, I'm going to promote her to the panelist so that she can be able to assist. The next question: when will the immunocompromised adults who received an additional dose be eligible for the second booster shot? The additional dose is pointless without being allowed to get another booster. So this person is calling for those who are immunocompromised, especially the adults, to get an additional booster shot. I believe Dr. Bamford will be able to assist on that. Next question: how many cases of this variant XBB 1.5 Omicron subvariant have been detected in South Africa in total? Is there any early evidence that it is spreading or causing any increase in hospitalizations? And how many might have, and how might the COVID vaccine booster program be tweaked? How many COVID vaccines are currently in stock in the country in total? Next question: how far is South Africa with working with the developing, or how far is the country developing its own COVID-19 vaccine? The next question: can you provide an update on vaccine stocks currently available? No, this one has already been asked by another journalist, and also those who are expiring. So the total number of vaccine in the stock and those who are expiring together with the dates. Next question: are there any reported increased hospitalizations and death related to the new variant globally? Next question: how does the new variant impact the rules in office staff or businesses? Should the business reduce the capacity because of the new variant? The minister mentioned that the arrangements for additional booster for people 18 and above will be concluded within the next few days. Does it mean this cohort will be able to go for another booster shot before the end of January? I heard Dr. Bamford touching on the implementation date of additional booster dose, but we can just re-emphasize on that. Zandile Mieza from SABC News is asking, are there any further details that can be provided regarding the patient's profile of the individual who has tested positive with this new variant XBB 1.5 subvariant? Are there any key observations that are noted regarding the patient's condition? And has this observation been informative in any way regarding the behavior of this particular subvariant in the human body? So this journalist, Zandile, is simply asking the condition of the first case of this variant, how's the case doing, and also any other further details regarding this case. So I'm going to just add the last few questions from that I initially reserved for the third batch, but I don't think there's a need to go for the third batch. We'll rather take all the questions. So the next question, the Minister of Health mentioned in his remarks earlier that the country will start testing wastewater from flights coming from China, the US, and any other country that has reported this variant called XBB 1.5 variant. When will this start? Next question: has Gauteng province seen an increase in demand for vaccinations or boosters since the emergence of this subvariant? And how's this activity at clinics and any other variant vaccination sites? So how are the the clinics and other vaccination sites coping, or are they seeing any high demand or people coming in numbers to get booster shots or vaccinate? The last two questions, with schools reopening this week and people being highly mobile during the holidays, will the government be pushing masking again, face masking again? Are there any updates to this effectiveness of face mask? What needs to, how many vaccination sites are still operating the countrywide and the department, and how South Africans check where they can get vaccinated? So on this one, we've got an app called www.findmyjab.co.za. So we are able to see your nearest vaccination site, the ones that are operational. So the very last question, can the panel respond on how the government and the department assist citizens who suffer from severe side effects, most possibly caused by COVID-19 vaccine? How many COVID-19 vaccines are currently registered with SAPRA in the country? So this was a very long list of questions. Members of the panel, if they feel that I need to repeat certain questions, I'll do that. I'm going to hand over back to the Minister to assign these questions to the panelists. Over to you, Minister.
Thank you very much, Foster. It's quite a long list. My numbering may also, okay, let me just, as the ones which you sent. So update on expiry dates, I think it also comes again somewhere down. So once it's dealt with, I think it will deal. And then Leslie, when you deal with that, I'm hoping, I know Nicholas Crisp has been largely managing this, but I'm sure you will have the information. You can also just deal with the update on the vaccine stocks of the two vaccines which we have. The next one, 13, DG could deal with that. I did mention that we have sent a letter to provinces in terms of improvement of testing, but I'm sure DG could comment whether this would require follow-up memo, circular, also on amending some of the previous guidelines on testing. DG, you could shed light on that, whether there will be a need for a follow-up circular on that. And then the next one, boosters below 50 years. I think Dr. Bamford has dealt with it, but she could come back quickly just to reiterate. And then the new variant in the Western Cape, I can just comment on that, and if MC Mbombo is still there, she could also say something, but I think I did explain in my earlier reporting, but I can come back to that. And then immunocompromised adults, when will they receive, well, eligible for their second booster? I think, again, Dr. Bamford can talk to that. How many cases of XBB? I can again restate, and maybe Dr. Michelle Groom could also comment on it, on the number of the XBB. That was on 17 Omicron subvariant detected. Is there early evidence that it is spreading or causing increase? I think I'll deal with that part. How many? I think, yeah, the stock of vaccines, the question has got too many unrelated, including on stocks of, yeah, okay. The next one, so I'll deal with that. And then Dr. Bamford will still deal with the stock issue. Developing our own vaccine, I can give some comment on that. But also both Dr. Bamford and DG, if they want to add on that, they're free to do so on our own vaccine capacity. update on stocks from Tamar Khan. I'm sure that I've already assigned that to Dr. Bamford. Deaths and hospitalization, new variant, I think will be dealt with under 17. So 20 and 17 will be dealt with together. Arrangements for additional booster for people 18 plus. Again, Leslie will deal with that. Zandile, any further details provided regarding the patient? I'll deal with this under question 17. Any key observations that were noted regarding the patient's condition? I think it also falls under 17. And then these are the ones which first you had also sent to me. And then wastewater testing, Dr. Michelle Groom can deal with that as to when is that going to happen, especially for airplanes. Any high demand for vaccine, if I had it well, in Gauteng. I'm sure, again, Leslie can comment on that. Issue of masks as the schools are reopening. Can I ask a Deputy Minister to deal with the masks, whether we want to bring masks for children or adults when schools open? Vaccine sites still open. I think Foster tried to deal with that, but DG and Leslie could deal with that. Okay. And what happens when people get side effects? What are the assistance? Again, DG and Bamford could respond to that. Okay, I believe, Mr. Mohale, this will be the last. It's quite a long list, and I hope that this is the conclusion of the responding. So let me kick off that. Just the ones which I said I'll deal with. The new variants and whether MEC for Western Cape could comment. As I've indicated there, MEC Mbombo, if she's still on the platform and been brought into the panel, could say something. But we did say in our report that this was a random sample. So when you do a random sample, therefore, you can't identify the individual. So it's not possible because it's an anonymous sample. It's brought in for sampling to sequencing, but not based on individual, but on the sampling. So that makes it impossible to know. And that's why we emphasize that it's possible. The patient might come from the Western Cape, but it's also possible that they may not. But in terms of whether there's any change in the epidemiology of COVID in the Western Cape, MEC Mbombo can still comment on that. Now, I think on the 17 is the one where the question was whether how many cases. Again, at this stage, it's only one case from the sample of the anonymous specimen. So that's why we're urging now for more samples. Those who are positive, that should be forwarded to through the NHLS and NICD to the genomic sequencing units, so that we can have more bigger samples of sequencing. So at this stage, it's only one which has been reported. There is no more in terms of the XBB. Evidence that it's spreading at this stage, because we only have one confirmed sample. There's no evidence of spreading. As we get more samples being tested, it's only then that this could be. We could have a bigger pool to can actually see whether, in fact, there is any difference in terms of. It is said to be highly transmissible from the countries like the US, as Dr. Michelle Groom indicated, but she could comment also on that. There is evidence possibly in the US of where it's moving closer, she said, closer to 40%, but this does not translate into any increase in severity and hospitalization. And then the vaccine stocks, Dr. Bamford will deal with. Whether we're developing vaccines in South Africa, The answer is yes. As you know that there are two entities which are dealing with this. On the one hand, we have through Aspen Pharmaceutical on their licensing by Johnson & Johnson. They're not necessarily doing new vaccines, but I think Aspen itself is looking at partnerships over and above with J&J, but they do have the license from J&J to produce vaccines. And then also through the mRNA hub, which is there in Cape Town, Afrigem, which is together with BioVac, working together in terms of the mRNA vaccine development. Afrigem has made quite some progress in terms of developing their own messenger RNA vaccine for COVID. And once that technology is established, other vaccines will be produced as well. So that's the situation in as far as that is concerned. I think, Foster, I will stop there. The other questions, I invite members of the team. I think Dr. Bamford and DG have quite a few. I did invite Deputy Minister as well to tackle the issue of whether we're considering masks to come back, especially as schools are reopening. So he could also come in. Can we then pass over to the rest of the team? Thank you. You can start, Dr. Bamford.
Thank you very much, and thank you for the questions. So the questions I've been asked relate primarily to stock of vaccines. So I think as people are aware, we do have large stocks of our two vaccines in the country currently. We have approximately 10 million doses of the J&J, the Janssen vaccine, and 8 million doses of the Pfizer or Comirnaty vaccine. The Pfizer Comirnaty vaccine, currently the doses expire at the end of March and the end of April. However, we do anticipate that the shelf life of the vaccines will be extended for a minimum of another 3 months. However, in the middle of the year, we may then face the possibility of some of those doses expiring. The Janssen, the J&J vaccines do not expire until 2024, and in some cases, 2025. There was a question about the pediatric Pfizer vaccine. We anticipate that vaccine will arrive in the country towards the end of January or the beginning of February. I think I did touch on the issue of booster doses, just to indicate that we anticipate that all adults will be offered another booster dose. We expect that this will take place in January. It probably towards the end of January, but nevertheless during this month. With regards to the immunocompromised, maybe just to reiterate, so we're trying to move away from number of doses. Any adult who has not had a dose in the past 6 months, whether they are immunocompromised or not, will be eligible to receive an additional booster dose. So the period between the doses will be 180 days. And as I say, every adult 18 years and older will be eligible to receive such a dose. Have we seen high demand in Gauteng or in the rest of the country? So of course, the first week and the week between Christmas and New Year is always a very quiet week, and there's a very low number of immunizations. We have seen some pickup now that we've entered the new year, but in fact, demand has remained muted. And we do really hope that with the new year, people going back to work, children going back to school, that people will come forward to be vaccinated. We are aware, because of the low demand for vaccination, that some vaccination sites, particularly in the private sector, have closed. But we always advise people, if they are looking for a vaccination site, they can always phone our National Health hotline, and there are people available who will advise them as to where they can be vaccinated. Maybe just lastly, with regards to people who have experienced adverse events following immunization, we have systems in place to monitor such adverse events. We know that such events do take place, although they are uncommon. They are closely monitored. All the data are published on the SAPRA website, and we have put in place the no-fault compensation fund so that people who have suffered injury or an adverse event, a significant adverse event following immunization, will be compensated. Let me stop there. Thank you.
Thank you very much, Dr. Bamford, and thank you, Minister. On the guidelines, following the ministerial letter to the provinces, the circular was released yesterday. I signed it off yesterday afternoon. So there is a circular with the testing guidelines that should have been distributed, because I signed it quite late yesterday. So it should be out already and available through the provinces and the facilities. Just to add on the no-fault compensation, is that the process is very robust, and there are specific expert committees that actually review the side effect, whether there is a causal link with the vaccine. And then when there's a causal link, then it then goes for adjudication in the by the no-fault compensation scheme, so that people can get the relevant compensation when that time is right. We would encourage, again, we will be publicizing this robustly, the Find My Jab website, where people must just get into that website, and it will give them, they put where they are, it will tell them which site is available and open in their area. Thank you very much. I will then hand over to Dr. Groom.
Yeah, so just to reiterate, it's just been that one sequence so far. We are sequencing and are encouraging the laboratories to send samples to the different laboratories who are doing the sequencing. We do put out, the NICD puts out a weekly report, which gives an update of all the sequences that have been found. And so this usually happens on a Monday. And so we will be, as usual, putting out regular updates on that. And yeah, as I say, I think it's likely that we may detect additional cases. We will be monitoring that, and we'll be watching data coming also from elsewhere in the world in terms of looking at severity, but there's been no increased severity associated with this variant. Just to touch on the wastewater surveillance, so we have been in talks with one of the Chinese airlines, and so the wastewater surveillance of that of the airline wastewater will most likely commence next week. But just to note that we're also putting out reports on the wastewater surveillance, just from wastewater plants around the country as well. So you are able to look at those as well on our updates. And just to touch on one, I think there was one question, Foster, just on the measles, and just to say that we're also providing weekly updates on the measles outbreaks, also on our website, which are updated on a weekly basis. Thank you. I think those were my questions. Back to you, Minister.
Yeah, so first, I think the last one is for Deputy Minister on the question of whether we considering bringing back masks.
No, thank you very much, Minister, and thanks to the wonderful presentation that you have given to us. I'm always reminded when you are in an airplane, they always say the government has lifted the compulsory wearing of masks, However, it is optional now. Anybody in this plane who wants to wear a mask can still do so. So I think that's a stand that we still have as a government, that this is optional. There's no compulsory wearing of masks. But what actually has come up from Dr. Branford now actually does indicate that we are calling on South Africans to maybe 50 years and above to get another additional booster, the 18 to 45, another additional booster. But for the 12 to 17 years, no booster needed as yet. Actually, because this is one age group that is not really much stressed by the disease. So again, also saying, going to schools, there may not be a need to wear a mask compulsory. It is just going to be enough just to take the precautions as outlined by the minister. But Minister, I just wanted to emphasize on one point that was coming in from another caller, that you called this meeting largely after consultation with WHO, after consultation with our scientists. Now, we don't have any other body in the world that advises ministers of health and also governments on these issues. Now, that caller probably was suggesting someone else could come and advise. But we just want to emphasize that thank Minister for taking time to get those concerns from those leadership. And this is just making the statement very authentic, what actually the minister has shared with us here today, that it is after consultation with these credible and experienced experts on health in the world, and also including those in our country. Thank you very much, Minister, and over back to Foster.
Thank you very much, DM. We have now reached the conclusion of our media briefing, but just before I come back to you, DM, to do the formal closing remarks, I'm going to hand over to Minister to give us the parting shot before we hand over to Deputy Minister. Over to you, Minister.
Well, not a lot from my side, except just to re-emphasize the fact that as much as we are saying we're not imposing any, reinstating any restrictions and not imposing any travel requirements, either to or from People's Republic of China or any other country. The fact of the matter why it's important to have this kind of discussion is because it's a reminder that COVID infection, COVID pandemic still remains in our midst, is still a risk. It's under control because of the measures which we know, especially vaccination. So again, we encourage all South Africans who qualify from the age of 12 now, also from 18 years in terms of boosters, over 50s, all those immunocompromised, all those as will be restated from time to time, updated from time to time. Please take time to inquire if you're not sure at your nearest health facility to find out, and you can also call, the helpline as was indicated by Dr. Leslie Bamford. So again, just to say we can overcome, we can remain stable and even get out of the pandemic if we work together. Thank you very much, Foster. Foster, you are muted.
Thank you, Honorable Minister and members of the panel for providing that comprehensive feedback that the country and the media have been waiting for since the past few days. So I believe now all have been clarified, but all other unresponded questions will continue to take them through a normal media interview. So on this note, I'm going to hand over back to the Deputy Minister to do the closing remarks. Over to you, Deputy Minister.
Yeah, thank you, Mr. Foster. Minister, I would like to thank you very much for the foresight that you have had in actually calling this media brief. It was also much more emphasized, also you recall in the meeting of the morning when you were actually briefing the NCCC. A lot of government leaders were very happy that you called that meeting to just allay the anxiety of the people in the world and people in our country, to say, some of them were even saying they were expecting you are going to be very hard on us and call on closing this, closing that. And I think this actually, based on the scientific advice that you received, but very timely to come to this space and actually get to our leadership, the president and all the ministers, and now at this platform, it has really helped us a lot. We now know that South Africans really relax, go back to their work, go back to schools, knowing that we must continue with the precautions that we take. And I think the emphasis that the minister is making must actually be the one that is guiding us. Provoked by one of the questions to say, why do we vaccinate when you know that you still get an infection? But it actually, the caller should actually say, you don't go into the ICU when you are vaccinated, and you don't actually have a high morbidity and mortality when you are vaccinated. So we call all of us to really continue to do that. And lastly, on my side, I want us to say to South Africans, yeah, do use the mask as an option. Sometimes I do wear it when I actually more protecting other South Africans around me, when I have a flu-like illness, and I really more to protect them and make sure that whatever virus I have, I don't spread it to them. So it will remain that way, optional, not compulsory. Let's move on. And thank you, Minister, for supporting and guiding us as a country in this regard. Over to you, Foster. Thank you very much.
Thank you, Honorable Deputy Minister and the members of the panel for updating the public as far as the COVID-19 situation is concerned, including the current variant which has been detected recently. We believe that we'll continuously provide the public with the information as far as COVID-19 situation is concerned, including other pandemics or health conditions like measles, that we continuously urge the parents, the caregivers, to make sure that their kids, as they return to school, they're up to date with the vaccination schedule. So on that note, I'm going to declare this media briefing adjourned, but they will continuously do the media interviews as per the request. Thank you.
Thank you very much. Bye-bye.
Bye-bye.
Thank you very much. Goodbye.